So I'm wondering, what was that first moment for you when air pollution became, something more than just a statistic and something that had real meaning?
I mean, I have to go back to when I was about 8 years old in Manchester, brought up in the centre of Manchester during the time when, of course, smogs were routine in the winter months. And I do remember a time when people used to walk in front of the buses with a torch so that the bus driver could see the curb. And so that really had a big impression on me as a child.
So I can't imagine what it must have been like to kind of grow up breathing that kind of air in. How aware were you of what it was that you were actually breathing in, and the kind of the impacts on people's health that it has?
Well, at the time, as a child, I mean, all you saw was everybody with scarves around their faces. The color was yellow or green. The lights in the streets were just hazy. And it was to be expected. It was one of those things that happened. And as a child, I mean, it happened each winter, and some winters were worse than others. And of course, my father, he was an auctioneer and valuer of cotton machinery in Manchester and along the Pennines. And they were selling off all the old cotton mills and the wool mills in Yorkshire. And he used to take me to these places. And, it wasn't surprising really that we were completely overwhelmed by the amount of coal that was being burnt in those environments. And of course, domestic coal burning probably was the most important at that time. But, this is how it's happened. And I suppose the population just became used to it, which is a horrible thing to have to say, because that's what you said in your introduction, Jordan. You kind of didn't think about it. And that's what, we didn't think about it until, of course, some wonderful studies in London showed the direct relationship between death and the 1952 air pollution episode in December, and the harvesting of a large number of people who died during those few days and subsequently. So that's had a big impact on me. And as a respiratory physician, I saw asthma and chronic obstructive pulmonary disease as a big issue, really, in our clinical practice. And every winter, of course, we used to get these episodes where our hospital beds would fill up with a combination of pollution and virus-related illness, really. And it was a cyclical process every single year. So something had to be done about it, and that's what got my interest going, really.
And when I grew up, as I said before, I kind of, I knew about air pollution and it was a fact of life. But at the same time, I grew up in the countryside and I never really experienced it. Right, I was safe from it. It wasn't something that I really had to think about. And yet, in my later life, I've met people who grew up in London, who it was, for whom it was all they ever knew. And some of them have, developed asthma as a result. And it's only through that contrast, right, that the air pollution becomes visible. And I know, Michael, you've spent so much of your life trying to really actively shine a light on that difference and on that inequality. So I'm be interested to know from your perspective, when air pollution became something that was seen not just through your own lens, but something that you really realized was, really unequal in its impacts.
What really struck me when I went to Berkeley to do a PhD, University of California, Berkeley, and I flew into Los Angeles, and I'd never seen anything quite so disgusting as the smog in Los Angeles, which was quite different from the British version. It was all due to the automobile in Los Angeles, and it was disgusting. One felt like it was the end of civilization. When I then got involved in looking at inequalities in health in the UK, and open-minded to all the causes, one thing I did was look earlier in life at childhood And here was all this evidence about how children were being affected by a whole range of environments, the social environment, but including the physical environment. That this British disease of respiratory disease in childhood, which was related to the environment. So I was concerned about adverse childhood experiences, positive nurturing, and the like in childhood. But it was the evidence that convinced me of the importance of the physical environment, of which air pollution was a key part. And in my 2010 Marmot review of health inequalities, we showed the evidence that environmental quality followed the social gradient. The more deprived, the worse the environmental quality. And one, not the only, but one component of that was air pollution. So it was clearly making a contribution to inequalities in health.
I'm really interested by your lived experience. Both of you have expressed that you've been in these smogs, and for me, it's an interesting window because air pollution is really largely invisible now, certainly in the UK, and these smogs made it visible. But at the same time, there wasn't that same knowledge of what actually these pollutants were doing to our health. And when you were breathing it in as a kid or later in life, before the connections between air pollution and poor health really were coming to the fore, could you sense something was wrong in the air? Could you taste it, or was it just something that because that knowledge wasn't there, it just wasn't really something that you thought about?
Well, firstly, I knew from my studies about coal workers, pneumoconiosis, and that industrial exposure to a variety of pollutants damage the lungs. And knowing about it and coming to London and catching the London Underground and blowing your nose, forgive me, after you've been in the London Underground is rather disgusting. And you think, my goodness, I know from my studies about what that black stuff is doing to coal miners and other workers. And here we all are exposed to this vile stuff. And then reading about historical diarists, is it Evelyn in the 1600s talked about the air in London being foul, that the air in London's been foul for a long time. And so you could still see it. All you had to do was catch the underground and you could see it. It was less easy to see looking up at the sky until, and you'll know this, Jordan, you spend a night in the countryside outside London and you say, hey, what are those funny things up in the sky? Oh, there's stars. I didn't know there were stars in the sky. I never saw any of those in London because the air's so polluted. And you become accustomed to it until you're in an environment where you see something different. And then you realize you've just become accustomed to this rather grim sky. But that means there are particles there. And people like Stephen have shown us very clearly that those particles are damaging our health.
And hitting every organ of the body, and including the bone marrow, Michael. And I think this is the change in the scientific thinking, really, is that air pollution isn't just a lung problem. That these little particles we've been talking about, and some of the gases even, get into the circulation, and it's where they end up, which is where the concerns are. And the recent studies, even in pregnant women, showing these particles can cross over to the fetal side of the circulation and lodge in the fetal developing lung and impair the development of the lung by 3 generations of airways as a result of high pollution exposure. So I think it's this concept now that air pollution isn't just an acute sort of, it's bad air today, fine tomorrow, but a thing that's happening across the life course from conception through to death, cumulative, like tobacco smoking was regarded as. And secondly, that it hits multiple organs. And in some people, it affects the lung, others the heart, others the brain, others the pancreas with diabetes. So I think it's this system attack by these environmental insults that really has changed the scientific debate, really.
And Stephen, I don't know if it's a general finding, but when I think it was the US 6-city study, that people who were more deprived seemed to get a bigger effect of air pollution, a bigger negative effect. So there was an interaction between other markers of social inequality and the air pollution effect. Is that a general finding?
Absolutely. And that's come out of more recent studies too, as you will know, where they've looked at more than 6 cities, up to 190 different cities around the world. And this, of course, the evidence becomes more powerful statistically, as you will know yourself. And what's interesting is you get these very, very powerful studies, is that there is no safe level of air pollution. So the line connecting mortality, all-cause mortality, and particle exposure passes through zero. And of course, no threshold is safe. There is no safe threshold.
Yeah, so my question, I agree with that completely. My question was about the fact that if you're in a more deprived area, the health effect of air pollution is bigger.
Yeah.
Is that certainly is.
It certainly is. And of course, this is a very sensitive subject now, because obviously if air pollution is one of the multiple factors feeding into inequalities, then how do you tackle that? As we can sometimes use the term wicked problem, because what you have here are multiple interacting factors in a deprived environment, and that's declining the health of people in cities like London, where you can travel from one side of the city to the other and lose 10 years of life expectancy as a result of the inequalities feeding in. And one of the reasons I went and did medicine in the first place is because one of my relatives was a man called Christopher Addison, who actually was the first Minister of Health in Lloyd George's government. And he, I think, realized as a doctor, he was an anatomist from Sheffield, but he realized that the reason why people were dying younger in those days wasn't just due to tuberculosis, which was the prevailing thoughts, but because there was this terrible poverty. And as a consequence, he put forward, obviously, a housing plan, which was the first council housing plan for the United Kingdom. But of course, that was politically inexpedient, and he immediately lost his job as Minister of Health and lost his seat, because as always, when you abut against politics here, you're abutting against a different a battle, which is what happened to him.
One of my teachers at Berkeley was a man named Warren Winkelstein, who came to fruition in Buffalo, New York. And he started studying air pollution because the sky was orange. And a bit like Stephen was saying, people kind of accepted the sky was orange. And he said, maybe the sky doesn't need to be orange, you know, Buffalo being an industrial town. And he started studying air pollution. Well, when the sky is not orange, it's harder to get people to notice. And I'm sufficient of a nerd that statistics upset me. I don't have to see an orange sky. And one of the ones that really upset me in London, if you look at schools and you look at oxides of nitrogen, the more deprived the area in which the school is located, the higher the concentration of oxides of nitrogen. And that upsets me as much as if I saw a child hit by a car. That hits me with the same immediacy. What are we doing? We're damaging the next generation by their going to school, being exposed to high levels of air pollution every day of their lives. And the more deprived the children, the more they are exposed. I say that hits me with the same immediacy as if you saw a child suffering in front of you.
I'd really like to unpack this a little bit and kind of go back to basics. You know, there's going to be a lot of people who are going to be watching this at home, and they're really not going to know very much about air pollution at all. So I don't want to spend too much time on the science, but could either of you just explain a little bit about what air pollution actually is, and then why that therefore means that some people get more exposed to it than others?
Well, in essence, air pollution in its broadest sense are chemicals, largely from man-made activities, being released into the atmosphere in different forms, in gases, as particles, and chemistry happening in the air itself at different times of the year that change the nature of those particles and gases. And so we have a mixture of chemicals basically that we're breathing in. Nitrogen dioxide was mentioned by Michael, and we've also mentioned particles, but also there's ozone, there's volatile organic chemicals that comes out of various people's combustion engines. And we have a variety of different chemical substances that we actually are now beginning to generate in the intensification and industrialization of the way we live. So farming, for example, which you mentioned, Jordan, you were brought up in the countryside. Well, farming now is a major contributor to the air pollution that's seen in London, because the ammonia gas that's given off by the chemicals they put on the land and the intensification of farming is forming these secondary particles in the air that get blown over London and people are being exposed to. So the air pollution itself is a very complex mixture of chemical substances, but the net result is that it damages human cells. And people vary in their vulnerability, as we mentioned with the inequalities, but also to their susceptibility. If they have certain diseases like asthma or coronary heart disease or hypertension, diabetes, they will become more vulnerable to the damaging effect of these chemical substances once they get into the circulation. And the other thing that's been demonstrated, and Michael hinted on this importantly, is that this occurs cumulatively. So this isn't something that just comes and goes. This is something that occurs across the life course. And a study that we did in Southampton at the Environmental Epidemiology Unit there a couple of years ago showed that air pollution back in the 1950s was still harvesting, and I hate to use that term, but I'm going to use it, people's lives prematurely now in 2020. In other words, the effects of that exposure during the first few years of life before the Clean Air Act of 1956 is still having effects now. And I think that's the important thing about the future generation, that we've got to do something about this now, not leave it for the next generation to clean up our mess.
Let me make a confession here. I should have, but I haven't, looked at the science behind WHO's estimates. And I was going to ask Stephen, because I presume he's a bit more careful than I am and has looked at the science. WHO estimates that globally, about 3.5 million deaths are due to ambient air pollution and another 3.5 million due to indoor air pollution. As I say, I confess, don't tell anyone, that I haven't looked at the science behind it, but I presume you have, Stephen. Are you happy with those numbers?
Yeah, I mean, they're about right. I mean, they vary in different parts of the world. So if you go into Southeast Asia, for example, or some parts of Africa, where you've got incredibly high levels of pollution inside, where they're burning biomass and wood and cow dung and various things. I mean, women and children, are exposed to exceedingly high concentrations. We don't have that so much here in the UK, but now we're beginning to witness the burning of wood-burning stoves and open fires and so on. And the old pollutants are beginning to appear again in the atmosphere as we go to biomass burning. So yeah, indoor air pollution is still a bit of a black box. We need more research on this. We need to know more about what's happening indoors. And I'm very pleased to, to say that, that is now beginning to happen, because I think it's going to be much more powerful, Michael, than we appreciated previously. And it might be one of the major factors connecting it with the quality of housing, the mixture of chemicals in the air that we breathe indoors. And you mentioned schools. I think that's a great example. But don't forget, inside vehicles as well, inside cars. I mean, you sit in your car these days and you have your blower on and you're wafting in particles and air pollution from the exhaust pipe of the car in front of you. And we know that vehicles contribute at least 35 to 40% of the air pollution that most people encounter in the urban environment. And it may be higher in some places. And I remember visiting cities in India and in China over the last 20 years where you couldn't see the sun.
Yeah.
And we've seen photographs, even now in China, as you know, where people just don't see the sun from one day to the next. And so the life expectancy of all those people is going to be affected by what they're breathing in. And yeah.
Absolutely. I was in Delhi in January before lockdown last year, 2020, and I can't remember what floor I was on in the hotel. And I looked out the window and I couldn't see anything. The pollution was so thick. And then they said the pollution is so bad, they recommended that people stay home. And I thought, what do you do if you're sleeping on the street? I mean, the indignity of being one of these street people and the lack of dignity, the lack of proper, and then they tell you, stay home. Don't be outdoors because of the air pollution. And it was such a dramatic illustration of the intersection between social inequality and the environment.
I was struck by something that you said, Stephen, about how, we have to do this now. And the experience of my generation is seeing that we've had all this information around for so long, and scientists all over the world repeatedly saying, we've got to act now, we've got to act. So why aren't we?
Yeah. So this, in a way, is what the Ella Kissi-Debrah inquest has actually brought into very sharp relief. As you know, on December the 16th, there was a second inquest undertaken on Ella Kissi-Debrah, a 9-year-old child who died of asthma back in 2013. And her mother, Rosamond, had fought for 7 years to try and get the inquest reopened. And what a brave and amazing woman she has been, really, in pushing, really, to the possibility that air pollution contributed to Ella's death. She approached me through her solicitors, who were incredibly concerned about this. And I spent 2.5 years going through the different notes, trying to unpick and unravel the complexity of Ella's asthma, which was amazingly severe and very, very complex. And she went to hospital and intensive care units 27 times in 2.5 years in 6 hospitals around London. And none of the specialists mentioned air pollution at all at any of the visits at any time in the 2.5 years. And I think when we were at the inquest, this really came out as being something very surprising. Why doesn't the medical profession know more about this? Why aren't health professionals taking some ownership, as they did with tobacco smoking, in terms of the diseases they treat, like asthma and coronary heart disease and so on? And there were no answers to that question. And one of my conclusions from all of this is the lack of engagement, really, of the Department of Health and Social Care and health professionals in the issue. It was being left to the Department of the Environment to sort out. And of course, it is an environmental issue. But what that case, that particular sad case, showed really was that health, as Michael has illustrated, is really what this debate should be about. And therefore, we desperately need health professionals to start beginning to speak out about this, to talk to their patients, to help them understand what they can do to improve the environment, and to talk then with the central and local governments, who of course have got the levers to create the systemic change that are needed. But unless we get health at the center of all of this, we're just going to be talking about meeting air quality limits, which is an environmental type objective, which has led us into this difficult situation we now find ourselves.
Absolutely. I just want to kind of home in on the why here, because it strikes me that there's a real tension here in that, and especially for healthcare professionals who are engaging with air pollution, and as the NICE guidelines stand, it seems like there's a lot focused on how you can limit your own individual contribution and also limit your exposure. But it feels like one of the big reasons we haven't made as much progress as we would have liked is because air pollution is so deeply embedded into the structure of our society. The energy that we burn, the cars that we use, even the way that we farm. So how do we navigate this tension when there's a deeply systemic issue, and it's really, really affecting the health of not just people in the UK, but all across the world? How can healthcare professionals kind of navigate that tension and go beyond, just the level of the individual, to really preventing this air becoming polluted in the first place?
Well, healthcare professionals clearly have a role, but this is not primarily a role for healthcare professionals. There's this problem, and it's soluble. We know it's soluble. Stephen and I have both referred to the improvement in air quality that happened in Britain and many other countries. I talked about the smog when I first went to Los Angeles in the early 70s. That's improved dramatically. So these problems are soluble. There used to be a kind of iron law about economic development and pollution, as if countries were going to have economic development, they would pump out more noxious gases, including carbon dioxide. We haven't mentioned climate in this discussion so far. And there used to be thought there's some sort of iron law, but that's not true anymore. We know that it's possible to have economic and social development without the same carbon intensity and without the same spewing out of noxious gases. It is soluble. And what I've been trying to argue is we need to address the inequality issues at the same time as we address the climate and environmental issues, because both require doing things really very differently. And we should be addressing them at the same time.
And we've heard, around schools when cars park there with their engines running, how unpleasant it is, how dangerous it is for children. And the fact that children are being deliberately exposed to high levels of pollution around their school, as Michael's illustrated, is an extraordinary finding. So, there is a social injustice here, not just a medical injustice. And I think if we did clean up our streets, for example, in urban settings, by reducing traffic and making public transport more available in a cleaner environment, then people can take ownership of their urban settings again. They can live in the streets rather than the cars and the lorries and all the other vehicles taking ownership of our streets, and that urban settings become human settlements again, instead of just places people commute to and then leave again at the end of a working day, and that children that are left there are left to pick up the pieces of everybody else's dirt. This is really not the way society needs to run. And I think there is a push now by the public at large to want to clean up our environment for all the reasons that Michael's mentioned, including climate change, but also the fact that, you know, we are running out of opportunities now in terms of health effects that we can make a big impact on.
The International Federation of Medical Students Associations, they always inspired me. These were young people who were committed. They represented more than 1 million medical students from around the world, and they were energetic and committed. And then as they grew up a bit, they became the Junior Doctors Network. And they were courageous and unashamed and well-informed and committed. And this is our future. I would say to these young doctors, go for it, be bold, be courageous, work from the science. The evidence is crucial. Don't just stand on a soapbox. Soapboxes, in my view, are no good. You're much better to stand on the evidence than stand on a soapbox. So work from the evidence. But then, with the evidence behind you, be bold and courageous. Show that we can be agents for a better world.
Yeah. And of course, you mentioned partnership in that list of 5 things, Michael. And one of the greatest things that we have are partnerships with families and patients. And, you know, there's nothing more powerful, as Ella Kissy Deborah's mother demonstrated, of having a family that's committed and willing to really rise above the parapet and fight the cause, not in an aggressive way, not in one that apportions blame, as Michael said, but one that seeks for justice, both medical and social justice, at a time when people are wanting, I think, to clean up the environment for the future more generally. I think the majority of young doctors, as well as other health professionals, you know, would be willing to take on this challenge. They don't have to do it alone. They can do it with their patients. I'm sure they would, you know, be helped by them, by general practitioners, and by others in the community. And there's been some great examples. I mean, Great Ormond Street Hospital, for example, has been one fairly recent one where they've really taken this on to protect the ill children in that hospital and to try and clean up the air in the locality. I think it's somewhere where you will know Michael well, but other hospitals are doing likewise now. And I think if we set examples as health practitioners, then the local councils and others involved in running communities and helping communities will actually join the gravy train and enable us to move forward. We can't do it on our own, there's no question, but my goodness, I think the health practitioner could do an awful lot.